Today I want to take a few minutes to talk about a product we've used called GluStitch. This is a product we found incredibly helpful, especially for bandaging on the back when a patient may not have a lot of help in caring for their wound. This is Dr. Dustin Portela. I'm a board-certified dermatologist at Treasure Valley Dermatology and Skin Cancer Center in Boise, Idaho. So you can see the video here is showing the final suture layer after excision of what was a malignant melanoma. This patient lives alone, and so he's unable to take care of his own wound when it's on his back. Bandage changing would be very difficult, and we have found GluStitch to be a really helpful tool to use for patients like this, but we've also found it to be helpful for patients who could otherwise care for their wound, but it helps us to have a great aesthetic result for the scar. This type of closure doesn't leave any sutures on the outside of the skin, and the running subcuticular method of sutures we do with a dissolving stitch that will just go away after a month or two inside the patient, usually with very little tissue reaction. So you can see that we make these final throws, that the epidermis has been well approximated. And now we are just matching up the epidermis. We're going to slow the video down for a minute and just kind of see that the area is being cleaned. We'll make sure that it's dry, and then we'll proceed with the application of the GluStitch. The GluStitch provides a watertight barrier on the top of the skin so that a patient is able to shower if they want to. We're going to speed the video up again just a bit, and you can see that the GluStitch goes on clear, and we use a cotton-tipped applicator just to make sure it doesn't run, but it starts to set up very quickly. We use a handheld fan to help speed that process up, but all in all the process takes between 3 to 5 minutes depending on the size of the wound. And you can see already on the right side of the incision where we first applied it that it's starting to crystallize. The GluStitch is going to form a kind of a sugary crystallized look to it. And this has never been a bother to any of our patients. It dries and they barely notice it. Now after just a couple of minutes, the GluStitch is almost completely dry. And this forms a watertight barrier, as we mentioned, and there's no external stitches that will need to be taken out. So we instruct the patients to leave the GluStitch on until it falls off on its own. And the practice that we employ in our office is that once the GluStitch is dry, we do put Steri strips on top, just so that there's less rubbing on top of that glue layer. The Steri strips are applied. A final bandage will be applied, and the patient will be instructed to remove that bandage in 48 hours, and at that point no additional wound care is required. The Steri strips and then the GluStitch will fall off in 1 to 2 weeks. Patients come back and see us a month later for a wound check, and with this method we're able to achieve a really nice cosmetic result.